Hey guys, it's Nurse Gwenny. The number one DM that I get on social media from people is, hey, I got a flight interview. How can I best prepare? And I got you. Let's work through this together. Number one, it happens in multiple stages. And usually that first call is just somebody from the HR office making sure that you have that firm foundation of experience and knowledge to be able to be successful in this position. So they're going to ask you, where have you worked? How long you've been there? What's the volume at your service, etc. That part's not very exciting. Then they usually bring you in for a written exam. And those exam questions are going to be pretty straightforward, much like the FPC or the CFRN. So if you've been studying for that advanced certification anyway, you've got this on lock. Then there's usually some scenarios. Sometimes they bring out a mannequin and they do a full-on high fidelity simulation, or sometimes it's just a tabletop scenario. And what they're looking for with that to make sure that you're organized, that you have a good assessment, and you know what kind of interventions these patient needs. And these are not going to be kind of gotcha questions. These are not going to be zebras. I want you to be thinking horses when you hear those hoof prints. It's going to be a case like a septic shock, a straightforward trauma, some kind of cardiac case like recognizing a STEMI. And what I always tell people here is never overrepresent yourself, your knowledge, or your skills. If you can recognize, for instance, like when I came to flight, I had never intubated before. I was an in-hospital nurse. Nobody had trained me. But in the scenario that I took, I recognized that the patient needed to be intubated. And so you say, I know this patient needs to be intubated, and I know that my priorities are to resuscitate before I intubate, that I need to put on passive oxygenation, that I need to position my patient appropriately. And here are the pharmacologic agents that I'm going to use for this patient based on whatever their pathology is. And as long as you know those things, they know that they can teach anyone how to intubate, and they're going to give you those skills. However, if you go out there and just try to Wild West it and pretend like you know what you're doing, and then you approach it with terrible technique, they're going to have big concerns about you because you're practicing something that you've not been taught how to do properly. So they're looking for that integrity piece and being a safe clinician, which means that you know your own limits and boundaries. Now, when there is something that you don't know how to do or you haven't been trained on, always follow it up with a willingness to learn. Say, I don't know how to intubate, but I'm willing to put in the work to learn how to do it. And I'm looking forward to that. And then the last part is usually just more of a personality interview. Are your partners going to be able to stand you for 24 hours at a time? Are you a good teammate? Are you going to have a good vibe with your partner? Are you good at communicating and conflict resolution and things like that? So just be yourself and show them who you are. You're going to do great.